Hello, everyone. I think we are live. I'm Dr. Michelle Millner, and I'm here with Maya on behalf of Professional Physical Therapy and
Hello.
Training. There's Maya. So Maya is going to be helping me out with questions and kind of the background stuff with anything that comes through. So she might be popping in a little bit. And if you do have any questions, feel free to put them in a chat. And that way we'll see them come up and Maya will let me know that there's a question and I will do my best to answer any of those questions as we go on. So Maya, anything else they should know?
I hope everybody's having a great evening. We're excited to see you all here. And we also want to make a shout out to Morris Sussex Sports. We sponsor and they're one of our partners. And we really appreciate them letting us stream on their channel. They're really great. George Muha's a great guy. He actually came in and saw us for physical therapy. So we're just really excited to be here tonight. I hope you guys all enjoy it. And like Michelle said, if you have any questions, put them in the chat. I'll be putting things in the chats, any links, anything like that. It will all go in there. So we're here to help you. We're here to answer your questions. So if you have any questions, feel free to ask because it just keeps us going. We love it. So, if you don't know anything about us, Michelle, they're all doctors of physical therapy in our clinic, and it's all one-on-one treatment. So it's all very specialized to you. So they're great people, and we just wanted to bring you this great information tonight. Make sure you're taken care of.
Exactly like Maya said, we are here to help you guys as much as you can. Neck pain can be super frustrating, and it can really mess up not just your day, but a lot of the activities that you want to do. You might not be able to play the sport you want to play, or you might not be able to, run a marathon, or you might be having trouble concentrating at work because your neck is hurting and you're getting headaches. So there's a lot of issues that we can try to address, and hopefully you find the information in this presentation helpful and useful immediately so that you can take this stuff and go with it. And if you have any questions, we're always here as a resource. All right. So I think we're ready. Maya, go ahead and put up the presentation here.
Okay.
All right, so I've entitled this The Answers to the 7 Most Common Questions About Neck Pain. And there's some practical application in here along the way. So we'll kind of go through one thing at a time. So if you already have some burning questions, by all means, please put them in the chat and we'll see them. And I'll let you know, is that something I want to answer right off the bat, or it might be coming up in the seminar. So feel free to put those in whenever you have an opportunity, right? So you got the answers to the 7 most common questions. So picture this. You're sitting in traffic. You're just minding your own business, moving along, waiting for the car in front of you to go somewhere. And all of a sudden, bam, something just slams right into you. Totally, out of the blue. You have no idea what just happened to you. And it turns out that you were rear-ended, right? And you have immediate onset of neck pain, arm pain. You're not really sure what's happening. You're kind of panicked. And, the next thing you know, you get out of your car and you realize that this is what your car looks like. Let's go ahead and hit the next slide there. Oh, it's loading. I don't know if you guys can see that. Oh, there we go. All right, so this is what your car looks like. It turns out you were rear-ended pretty severely. Makes sense that you're in a lot of pain after something like this. And it turns out, for those of you who don't know, this is actually my story, right? I'm actually a sufferer of neck pain due to pretty significant trauma. This is my car. This happened fairly recently. I was on the highway, stuck in traffic, and someone just slammed into me and left me with a number of injuries, one of which was severe whiplash. And, missed some work, had to take some time off, and I've been actively recovering from this injury. So I get it. I get how frustrating neck pain can be. I get how it can impact your life. It can cause all kinds of issues, which we'll talk about a little bit more. And it can be very, very damaging to your personal well-being and your emotional well-being and a number of other hosts, because sometimes you just don't know where to go. You don't know what to do in the next step. So hopefully this seminar helps give you a little bit of peace of mind that a lot of us as therapists are helping people with their issues, but a lot of time we actually have personal experience with a lot of these injuries. So we have a unique take on it, and we can provide a lot of value that way. So let's just move to the next slide. Now, my case was pretty dramatic, as you can tell. Not everybody has trauma like that where you get rear-ended at a high speed, but there are many causes to severe neck pain that end up impacting your day to day, that end up causing problems. It might be that car accident. It could also be that you were injured in sports, like tackle. This is a rugby player getting tackled. Could be gymnastics. You may have been at the gym and done some overtraining, like this guy here, trying to jump rope, weight lift, and do a barbell overpress all at the same time. Those can cause problems. But other things are a lot more insidious, meaning they just kind of come up over time. And those are those people who, don't really have any major issues for a long time. And then you kind of notice a tweak one day, and then it just kind of creeps up a little bit more and a little bit more. And it seems like sometimes it's better and sometimes it's worse, but it's just kind of creeping up, getting worse and worse. And those are, in a way, overtraining injuries as well, or overuse injuries, often caused by things like sitting at a computer with really poor mechanics and poor setup for success. And so you end up creating these neck issues. It could be from undertraining, meaning you've kind of gotten into a pattern of not exercising, of not being strong, and you end up with what we call an upper crust syndrome from being forward. And so you'll end up with tightness across your chest and a lot of weakness in your backside. So you actually aren't able to really stand up well, and that can lead to some neck pain. And then my most common thing I would say right now that's causing a lot of pain is what we call text neck, right? This idea that when you're looking down at your phones, your head becomes very heavy. And so over time, you end up straining your neck muscles, not because you've done anything very stressful, but because you've done something very repetitive over long periods of time with very little rest breaks to those muscles, right? So your head becomes really heavy when you are constantly looking down. If your head is very straight, it only weighs somewhere between 10 and 12 pounds. But for every 5 degrees that you're moving forward or leaning forward, you're adding a substantial amount of weight to these muscles. And then if you're staying there for like 2-3 hours, which some people do on their phones for quite long periods of time, you're ending up straining those muscles and creating a different type of overuse injury. Overuse from training, actual exercise, but this can be overuse from simply what you would say. People will come to us and say, oh, I didn't do anything. Well, you didn't, but you kind of did, because you weren't doing anything different than looking down. So these are common causes of neck pain. Now, when a situation like this arises, you can have a variety of different symptom patterns. So let's just cut to the next slide here, Maya. I'm not sure if Maya can hear me. Oh, there we go. Came up. So you can have a variety of different symptoms that are actually caused by neck problems. Most of us would think of this traditional, like, oh, my neck is sore. I woke up one morning. This is another thing we hear a lot, like, I didn't do anything. I woke up one day and my neck is just killing me and I can't turn my head. So now I'm having trouble driving. I'm having trouble looking at the TV. I'm having trouble concentrating at work because I can't turn my head. That happens a lot. Sometimes we call that like an acute wry neck, meaning you just have this sudden onset. That can happen. It usually presents with pretty severe pain and lack of range of motion right in the neck area. Alternatively, if it's more of a chronic situation where your head is constantly forward, sometimes you end up with actual headaches. There are things called cervicogenic headaches, meaning that the pain is coming from your neck or the cervical area. And so that can create a lot of pain around your whole head, oftentimes coming right across the front, sort of behind the eyes, or maybe up into the back of the head. Those are cervicogenic headaches, and treating your neck can lead to reduction or even elimination of these symptoms. We also have upper back pain, can be caused by neck issues. These vertebrae, those are the C2, C3, they radiate to certain places. The nerves from there radiate to certain places. So oftentimes if you have a neck problem up here in the middle of your neck, you might not feel it that much in your neck, but you'll actually feel a lot of shoulder blade pain down the back. And that is a fairly common occurrence. People come in and they say, oh, my upper back hurts, my shoulder blade hurts when I, turn this way or I do that. And what it actually turns out to be is not the upper back being the problem, but the neck being the problem. And then the other thing, which people don't realize oftentimes, is that all of the nerves that come out of your neck go down your arm, right? So when you have a neck issue, sometimes you can actually get pain all the way down to your hand, which may seem completely unrelated to your neck. But in actuality, if there's a nerve being pinched somewhere along this pathway, the symptoms can show up in your hand. So you might have some weakness in your hand, or you might have numbness and tingling down into your hands. That can happen all from a neck issue. So it's important to take a really good evaluation of an entire situation and say, okay, well, really, how did these symptoms come on? Where are the symptoms? And then it's important to have a thorough examination of those symptoms to rule out where the problem is not coming from and where it is coming from. And you need time to do that as a clinician. You need a little bit of time to do a thorough evaluation. And that's where, if you're not sure where these problems are coming from, it's important to see a professional such as ourselves and get a clear picture of where the issue is coming from. Because if you have hand pain and you're doing these hand stretches, all day long, they're not going to get fixed simply by doing that if it's coming from your neck. So you want to make sure that you're taking a good look at that. All right, so let's talk a little bit more about just the mechanics of the neck and some of the anatomy to help you understand how it works and why you can get some of those symptoms we just talked about. So this is just a nice drawing of the neck, and I think it's helpful to understand that your neck has, or your spine especially, just has a few main functions, right? The big one is protection of the spinal cord. So, what I mean by that is you have all this bone, that's your vertebra. Its job is to encapsulate the spinal cord. And the reason for that is your spinal cord is your information highway between your brain and the rest of your body. So, if there's a problem up here, the connection may be interrupted from top to bottom. I'll give you a good example. I had someone in here recently who had actually been in for tight hips a long, long time ago and had always complained that they had tight hips, right? Well, after treatment, and this person actually had to have a surgical procedure to alleviate tension in the neck for some upper body issues, some weaknesses, all of that stiffness in the lower body went away as well. And the reason for that was there was actual compression of this cord. So the cord was being tightened down, and that affected the entire body. So it's really important that the spine, especially the cervical spine, have good clearance for that spinal cord to come through and to keep it protected, but also well lubricated and not have any compressive forces on the spinal cord. Right. So the other thing is to protect the nerves that are coming out from the neck. So each vertebrae sits on top of the next one, kind of like a stack of blocks, and the nerves come out in between. So we want good clearance here to make sure that those nerves, as they come out, are protected and safe and don't get pinched or overstretched or anything like that when we're moving. These joints, though, are probably the most interesting feature. They allow us to move a ton. Our neck is super flexible. We can move in all kinds of directions, right? You think about your knee or your elbow, it just goes two ways, right? Your elbow is bent or it's straight. That's it. That's all it does. Your neck can turn side to side. It can look up and down. It can side bend side to side. It can do combination movements. So you can look down into your elbow, or you can look up on an angle. It has a lot of motion to it, and that gives our head a lot of freedom of mobility. So it's really important to keep your neck healthy. And then the last function of the neck, or an anatomy feature, is this disc in the middle. And we all hear a lot about discs, or herniated discs, or bulging discs, and we'll talk more about what that actually means in the next slide. But essentially, the disc is a cushion, and the shape of the disc is kind of like a jelly donut, right? You got a nice outer edge that supports the entire structure of the donut, and then you have this inside that's kind of jelly-like. It's soft and squishy. It acts like a shock absorber between the discs, so it holds your head up and it helps support the actual weight of the head, right? And when you're moving and bending, it kind of ebbs and flows a little bit, so that as you move one way, the fluid moves over, so there's space to move. If you move the other way, the fluid moves the other way. So there's some that helps with mobility and cushioning between each of the vertebrae. Okay. Now, what happens when something goes wrong with this disc? Right. So let's move to the next slide. So If the outer edge, the outside of the jelly donut, gets a little nick in it, you can have what's called a bulging disc. So what that means is that the outer edge, the jelly donut, it isn't broken. It's not perforated, but it's kind of like squished out a bit on the edge, and it comes through just enough to stick out into that space we talked about earlier where the nerves come out. If it's a small bulge, it's not going to affect that nerve at all because the nerve will still have plenty of space to do whatever it needs. The problem comes in when that bulge turns into a herniation and it gets even bigger and it pushes on that nerve. And then we get nerve symptoms. That might be going down the arm, it might just be into the neck, but it can become problematic. The interesting fact is that most people, depending on your age, but most people have some sort of abnormal disc issue when you look on an MRI or an X-ray. So having this in and of itself does not always mean there's symptoms, but it can lead to symptoms if it's very irritable and if it's very acute. So it's something to, I think, be helpful to understand where pain can come from sometimes, but it isn't always the answer. And that's, again, where that thorough evaluation becomes really, really important, right? Now, surrounding all of this, hold on, I'm not done yet, Maya. There we go. Sorry about that. Now, surrounding all of this tissue down here, the bone and the disc, we have a lot of ligaments that attach on the front, in the middle, on the back, in between each of these spines that come off. A lot of structure to help us stay up, to keep the blocks or the donuts, whichever way you want to think about it, to keep them stacked. When you have a whiplash injury, like I did, what happens is you get a quick over snap on those ligaments. So they get overstretched very quickly, and then they have to go back the other way. So they end up being a deep, deep sprain inside the neck. Right? Any kind of trauma can lead to that. If you fell down the stairs, that might be that situation. If you were in a sports injury, that might be your situation where you had this quick overstretching. And I think it's important to understand how deep those structures are, because when we get to the healing time portion of this talk, it'll help to understand that these deep structures can take a little bit of time to actually heal. And then it's just a nice visual that you have all of this musculature around the neck supporting that right above all of the ligaments. All right, so let's just jump to the next slide and actually get to the questions that I usually get asked. So that's just a nice introduction. Try to get us all on the same page and make sure that we understand the language a little bit. One of the best or most frequent questions I get is, do I have bad posture? And sometimes people will just come in assuming they have bad posture. It's like, oh, my posture's terrible. And the answer is maybe. Maybe yes, maybe no. For some people, especially as we get older, we do tend to get stiffer into like a flexed forward posture. But that's not always the cause of pain, right? Your posture may or may not be contributing to your pain in some situations. What's more important for your body is to move. The problem is more about this like text neck idea that we talked about on the earlier slide. Most of us just spend too much time in one position. So the reality is, it's not so much your quote bad posture in most cases. It's actually more that you're not moving into your next posture. So the reality is, your best posture is your next posture. You want to be constantly switching positions. And you want to try to make sure that you're never spending a ton of time forward, and you're also never spending a ton of time back. You want to break things up throughout your day. You want to change positions. People get into trouble when they don't move. And this is a really good example of it. Optimal posture would be great. But if this gentleman here never changed that upright, balanced posture, he would also begin to have problems because he's never moved, right? We want mobility. We want to be able to move through our motion. So your best posture is your next posture. All right, let's move on to the next question. Good. So along with that theme of posture, a lot of us these days are sitting at desks, and desk posture is definitely something that I spend a lot of my time telling people about and educating them on what to do. Now, rule number one would be your next posture is your best posture. So my favorite suggestion, and this is a practical thing, hopefully viewers and listeners right now can implement right away. is that you want to change positions and move about every 30 minutes. Okay. If you are sitting at your desk for hours and hours upon time and you're never changing positions, you are at some point, your body will break down and you will start to have some sort of neck or back issue. So, best thing, change positions. Now, not all of us have that freedom. We often get wrapped up in our jobs. That's life. It's not always optimal to be like, oh, I just have to get up now. You might have a meeting and not be able to do that. So, in the absence of being able to get up, you want to try to maximize your position as best you can. And there's a couple of schools of thought on this, but I generally suggest that people make sure they are sitting in a seat that is supporting the back and supporting the elbows in particular. If you're sitting at your desk and your arms are kind of reaching out in front of you, and they're up really high, your neck muscles have to work really hard to hold you up. So, just like we talked about the head looking down, if you're holding your arms up all the time, it's the same thing. These muscles are going to get overworked. So, try to position yourself in a way that you don't have to work very hard to type on your keyboard or to use your mouse. You want to try to position yourself so that your elbows are supported. You're able to look directly at your screen. If you have to have multiple screens, try to fit them in a way that the main screen's in the middle, but you're able to look easily from side to side. And a chair with wheels is great because you can, instead of turning your body, you can pivot the seat. Alternatively, standing desks are really helpful because you can alternate. Again, changing position is the best option here. You can sit, you can stand, you can move around a lot when you have a standing desk. And our third option, this is the newer technology, I suppose, that's coming out now, is this idea of a zero gravity chair. So this gentleman, his screen would be like up here. He is literally completely reclined. There's almost no gravity acting on his neck at all. He's completely supported. For those of us who are really working tons and tons of hours at a desk or screen, or you have significant problems with your back or neck, this can be a really good option as well. So those are some things to think about with your desk setup, right? All right, let's move to the next slide. Does anybody have any questions so far? Let's do a quick check-in here. I think we're good. I don't see questions. Maya hasn't hopped on, so I'm guessing we're good. Okay. So back with this posture idea, or, truth to be here, the second part of this. The other, working, we do spend a lot of time in one position. Ideally, you could move around a lot. But when you're sleeping, you also spend a lot of time in one position. And we don't really have any control over this because sleep is something that you kind of develop these patterns when you're little. They're very unconscious. They're just how they are. So the best we can do is try to find the best match for a pillow or a mattress, right? And what I would suggest here is that everyone is an individual. There is no single one brand of pillow that's better than another. Expense is probably not going to be the thing that determines whether or not a pillow is better than another. It's really individualized to what your preferences are, to what your tolerances are, and you want to try to optimize your position as much as possible, but still maintain your comfort level, right? So the best suggestions I currently have for side sleepers in particular is to try to select a pillow where your head stays in a straight alignment. If you're kind of cricked up this way, you might end up straining your neck. If you're the opposite way, you might end up straining your neck. What you can do, or pillows that we have found to be really helpful, are we would call like a two-seam pillow, or some people call that a gusset if you're into sewing. And it creates a nice little cube shape, right? Our necks and shoulders make a 90-degree angle. They're cube shaped. So having something like that might be helpful to get your head into a better position. If you tend to be someone who likes to, really tuck up, that might be a hard habit to break. But if you can get your arm out from under you and have a nice cube-shaped pillow, you might find that you don't need to do this because you're supported by that pillow. Now, when you're laying on your back, it's the same idea. You kind of want a straight line between your ear and just in front of your shoulder, nice comfortable position so that you are supported, but you're not strained. You don't want to have your head back too far. That can be really uncomfortable, a little stressful on the front of the neck. And you don't want it too high because that's going to pull. That's basically the same position as a text neck, right? You want to try to have that flat, straight position as much as possible. And pillows do matter, but everyone is very, very individual on that. All right. Any
in the
questions so
show.
far? Yeah.
So we do have. Oh, sorry, I'm trying to clean my camera. So we do have a few questions. One of them is Sally asked, "What do you recommend for like a stomach sleeper?"
Great question. Stomach sleeping is tough. So what I usually suggest is investing in a body pillow so that instead of being on your stomach, you're actually in sort of like a 3/4 turn position.
Okay.
So you could visualize like
Like
you'd
a
have
like a almost like a pregnancy pillow, those ones that like
kind
wrap
of.
around you. Okay.
Yeah, kind of. So you can be, you'll feel like you're on your stomach because you have something pressing on your chest, but your
Hmm.
neck can stay in a much more neutral position that way. So your arm, like if you're, let's say I'm laying on my left side, that's, I'd
Yeah.
be laying here. I would actually have my left arm back. I'd have the stomach, the pillow in front of me and be draped over the pillow, but I wouldn't
Okay.
have it on my head. I'd have my head at a better level so that I could keep my neck a little bit more in a neutral position. Right.
Okay. Okay. Because I know, like, I'm a side sleeper and I sleep with like a pillow in between my arms, a pillow in between my legs. I know how hard it can be to change your sleeping habits. So it's good to know that you have options.
Right.
And then from the last slide, somebody asked, they work from home and they don't have a good setup, so they tend to sit on their bed a lot and work. They know that it's not great for their neck and back, but are there any like exercises that you recommend to do throughout the day
Mhm.
that could help? Or like, is there any certain desks that you recommend that are like comfortable and I guess effective?
Yeah, great question. So the exercises, like I said, changing your position is always the best thing. So if you could, if you're on a laptop, I'm guessing this person is on a laptop. Is this person on?
Yeah,
Maybe they could answer
yeah.
that. Yeah.
I
So
don't know. I would assume they are
I'm guessing
if
you're on a
they're
laptop
working
if
on
you're
their
on your
bed.
bed.
Yeah, yeah, yeah.
Yeah. So a couple of things. If you are on your bed, you can position yourself a little bit better on the bed too. So for instance, having a better pillow behind you so that you're a little bit more supported and upright. The other thing is you
Yeah,
could take a pillow and put it under your hands so that you're under your elbows so that you're more supported and have an actual desk like one of those bed desk things. I'm
yeah,
guessing.
like the ones that are
Yeah.
pillows on one side and then like a
Yeah,
pillow on
or
the or
even
a
like a
bread
tray. It could
service.
be like a tray table. Some of them have that. So that's one thing while you're
Yeah,
sitting in your bed. I'm still a big fan of standing desks if you can get one. I know our office just bought one at Costco. I'm on it right now. And
yeah, it's
Jess
great.
and Marie love it because it goes up and down all day long. It can fit to your height. Chair wise, a good solid chair where you're more upright is very, very helpful. I really
Yeah,
recommend just trying to change position as much as possible so you're not constantly like hunched
yeah,
over that position if that helps. But I know it can be tough for
yeah.
sure.
Well, and I know so many people are working from home nowadays. It's good to give, obviously we want to make sure that they have their options too because it's very popular nowadays. So many people are working from home, so we want to make sure that people from home have their options too. So,
Absolutely.
and then I have a question. I don't know. I guess I could save this for the end.
You
But
tell me.
okay, so I signed up for obviously I signed up for all the information that we got from betterneck.pt.com. And Dr. Matthew, if none of you guys know, if you sign up on there, you get 5-day series to like a better neck and things like that. And he talked about the upper cross syndrome, and it was really surprising. I'd never heard about it before. Really, like it's not something that people just talk about. And it's really surprising. So, like, what exercises would you recommend to um, reverse it or prevent getting upper cross syndrome? Because
Mhm.
I think that's something that I have. So,
Yeah, I think most people, especially people who sit, end up that way. You kind of round forward and you get really weak in the back. So, two simple exercises to start with: doorway stretch for your chest. So you'd put both hands in the door, one foot in front of the other, and kind of gently lean forward to open up that chest. Super
okay,
simple. You want to hold that 20 to 30 seconds and then back out of the stretch. Repeat that 2 or 3 times. And you could do that several times throughout the day. Right. So when you're
okay,
taking those breaks, those 30-second breaks, you can take that time through a doorway and get that stretch. And depends on where you're most tight. You can get a really good stretch down low, but it might even be helpful to get the arms up high. Since we all spend time down here, we don't spend a lot of time with our arms overhead. Sometimes it can be helpful to kind of get your arms a little higher in the door and really open that chest up. So that addresses the tightness in the front, right? And if we're looking to strengthen the back, easy exercise, squeeze your shoulder blades together, right? Try to squeeze your shoulder blades together. Hold that for about 10 seconds at a time. Do about 10 reps of that. You're squeezing as hard as you possibly can without your neck coming forward. I think that's important. It's not this, right? It's open the chest, bring the shoulder blades back. And that can be really helpful. You know, just activating those muscles to get you into a better position can be really helpful.
All right. Thanks, Michelle. I'll let you get back to it, okay?
Awesome. Thank you for those questions. Keep the questions coming, everybody. We got great questions. Those are awesome. Cool. So let's jump back in. So we talked about stomach sleeping, talked about side sleeping here. All right. So that's all, postural positioning stuff, dealing with some of those overuse issues that you get from sitting at a desk. Now let's talk about some other clinical questions that we get quite frequently with neck pain. So big question I get, do I need an x-ray or an MRI? I've had neck pain, I've been dealing with this for a couple of weeks or a couple of months. Do you need an x-ray or an MRI? And the reality of this is that diagnostics like x-rays and MRIs are really only a small part of the picture. That's why I mentioned earlier, like having a good conversation with a clinician and a really thorough exam goes a long way in determining whether or not imaging is even necessary. Most people don't need imaging for our typical achy neck kind of situations because most people at any given age have changes in their spine. Those herniated discs I talked about earlier, most people have them, okay? But they don't hurt. If you took a room full of 100 people who are over the age of 50, almost all of them would have something wrong on an x-ray or an MRI. You would have signs of arthritis. You might have some herniated discs. You might have some stenosis. This is another word we hear a lot that people are really nervous or anxious about. And in some cases, those are causes of pain, but in a lot of cases, it's just part of the normal aging process. As we get older, our spines do change. A healthy, normal neck has this nice curve. As we get older, it starts to straighten out a little bit. As we start to bend forward, maybe in your 60s, 70s, it starts to degenerate a little bit through the front. And it can even go the opposite direction if we allow it to get very, very bad. Now, if you're doing the right exercises and you're helping strengthen your body all through your 20s, 30s, 40s, 50s, and you're working on counteracting this, you will counteract quite a bit of it. You might be able to stay in phase 1 or a phase 2, but you will always have some degenerative changes as we age. But that does not mean you should be in pain, right? I think that's a very important distinction to make. Just because you have arthritis or just because you have degenerative disc disease or just because you have changes on MRI that show that you might have some bulging discs does not mean that you should be in pain or that you'll never be out of pain again. That's where a really skilled physical therapist is super important to come in and take a really good look at you and say, oh, well, what can we work on and what can't we work on? I can't change your arthritis, but we can fix this forward head posture. We can get you to open up your chest. We can strengthen those back muscles. And making those changes, improving that, can go a long way in preserving your neck and, more importantly, making sure you can function right. So you can do the things you want. You can play golf. You can turn your head when you're driving a car. You can exercise at the gym. Whatever that thing is that you want to be able to do, there's no reason that you can't do that most of the time. Now, there's only one exception to this. If you're like me and you were in a car accident or you had a fall or you have some sort of trauma, you should always get some imaging done because you just don't know what could be lurking underneath. Most of the time it's fine, but you could have a small fracture or something that doesn't come up, that you need to be aware of that you wouldn't see any other way because you're in pain already. So if you just have kind of an achy neck, most of the time you don't need an x-ray or an MRI, but if you've had any trauma, you should definitely get an x-ray or an MRI. And if you have a question, you're kind of unsure what you should do, again, we're always here to answer any questions. that you have. So you can always give us a call, and we'll be happy to get on the phone with you and talk to you about it and see if if that's something that you need to do or not. All right, so let's move on to the next slide. Here we go. So, you're someone who has had neck pain for a while, and you're thinking, oh, I've got all these degenerative changes or whatnot. Do you need surgery to fix this problem? You've been struggling for a while. Do I need surgery? Another question I get a lot of, especially after you've gone to the doctor and you get this x-ray or MRI and they tell you you have stenosis and they tell you you've got a herniated disc. And the answer is it depends. Again, if there's trauma or something like that, you might need a surgery. I'm not saying that that's not the right thing to do. If you really have a lot of compression, you might need a surgery. That example I gave earlier, that individual had compression around the spinal cord. That's a serious concern. She needed a surgery. That person needed to have a serious medical intervention. But a lot of the time, exercise can overcome a lot of the challenges. And I think it's important to understand that surgery is not a cure-all. It's not a guarantee to work. So if things are working without surgery, it might be best to consider moving in that direction. Surgery takes a lot more time to heal from than you think. The recovery is not like, oh, go in, clean it out, and you're all better, right? They usually make an incision in your neck. They might have to put some screws in if you're going to do a fusion. And if we take a look at this healing schedule, if you've had a bone graft or like a fusion like this person, you're looking at 2 to 3 months before that bone is even remotely healed. So for 2 to 3 months, you're not going to be functioning. If you've had a ligament graft or an issue, that can take almost 2 years to heal at its maximum. Some people are faster, but a lot of people go longer. It takes a lot longer to heal from sprains and strains than people think. So here, grade 3 sprains, this is that whiplash injury. If you were in a lot of pain with your whiplash injury, it could take you up to a year to heal. Surgery, up to a year to heal. Not everyone, but that range is fairly big, and you want to be considering that in your day-to-day. So, if you're a really active individual and your neck pain is bothersome, but not stopping you from doing what you want, something more conservative like physical therapy might be able to address some of those issues you have and get you moving without the negative side effects of surgery, right? You can avoid that surgery. Some cases that might not be true, so it always depends. But I think, I think it's really important to note that, surgery is not a simple solution, and it should always be the last solution that you try if everything else hasn't worked, right? So I think that's really important to note. Any questions on that so far? All right, no, I think we're good. All right, let's move on to the last, not the last, we still got a few more slides to go through. All right, and then another big question I usually get is, do I need a massage? And again, that depends. I mean, I like massages. I go for massages sometimes. They're great. But most of the time, you can invest in yourself and have some tools on hand that will help you alleviate your own neck pain. We do, when you have any kind of pain, your muscles respond to that and they create these knots, which are just somewhat of a misnomer, but essentially it's a muscle spasm. And it could be like a trigger point. They have a couple of different names where you have like this taut band and it gets really painful and sore and tight. And when you push on it, it's really painful. And so there are ways to alleviate that on your own without having to go to a massage therapist. There are exercises and tools and products that you can do. And these are some things that we actually use in the clinic all the time. We love them. And I wanted to spend a few minutes talking about them. So like a foam roller, awesome tool. Absolutely great. You can see this person doing a really nice upper back stretch. So when I was talking about the upper and cross syndrome, this is a treatment we often do for upper cross syndrome because what it does is it stretches out your chest, right? You're actually, instead of being bent over, you go all the way back. I always say this is my favorite anti-sitting stretch, so I wanted to make sure I included it. The only comment on this picture I have is if you do have active neck pain, I would actually put your hands behind your head so that you're a little bit more supported. But rolling back over this is great. And I teach a Pilates class, actually. At the end of every class, I have my participants do this exercise simply because I know we spend too much time forward and we need to open up the other way. So foam rollers, we actually sell them here. Christmas is coming up. Just saying, it might be a good gift for yourself or maybe for someone you love who's sitting at a desk all the time. This is a great way to address all of that tightness across the chest and make sure that your spine is moving really, really well and taking off pressure from your neck. Another option that we use is these lacrosse balls. You could pick these up just about any sporting goods store. It's like having a trigger point right in there. You can use a wall, how this person is using it, and just kind of roll back and forth over the knot. It takes a bit of effort. It's not as perhaps comfortable as maybe a massage would be, but it is something that you can do, and you could do this every single day on your own. Now, my personal favorite, and in our clinic we use this a lot, is a hypervolt. Here's a picture of it, and I actually have one here to sort of demonstrate how this works. So the hypervolt is a high-powered massager. This is the most powerful version, but they do make a smaller one that is charging at the moment, so I don't have it with me, but this is one of my favorite tools, and it's in our clinic. We use it a lot for people who tend to be prone towards tension. This is a really, really great way. It comes with a number of different tips. For the neck specifically, I might actually suggest that you use the softer rubber tip. But what you'd want to do is get into these knots. So if I can just kind of move my hair out of the way here. You just turn it on the bottom, and it's got 3 speeds. So first speed, kind of not too intensive here. And for the neck, because it is a sensitive area, it's not a big bulky area, I usually recommend people stick with the lowest level. You can literally just take this right onto that same area and massage your own neck as much as you want, right? So we might say 2-3 minutes, whatever it might take. You might even go for 5 or 10. You can come all the way up and around to the front. I would not recommend coming up into your head, but you can stay into those areas where most of us feel there's a lot of tension, right? Right through here. You might even come down into the front of your chest and open up, because you could do that and help yourself with that upper crossed syndrome idea. If you have shoulder pain in the back, there's no reason you can't reach across and get the whole back of the shoulder. And if you're fortunate enough to live with someone who's willing to help you, they could do it for you, and it's much, much easier that way. But it's a great tool. We sell them in our office. Like I said, Christmas is coming up. Maybe it's a shameless plug, but I think it makes a great gift for other people. And, how much are the hypervolts? Yeah, great question. So they are, Maya, correct me if I'm wrong, but I think they're $349 right now.
Are they on the Hypervolt? Well, the Hypervolt Go, which is the smaller version.
Yep.
We have a smaller version, the Hypervolt Go, which is a newer version. That one is $199, I believe. And then the Hypervolt, the Bluetooth, I believe is $299. I'd have to double check on that. But okay. I know the Hypervolt Go is $199. And then we also have the Hypersphere. I don't know if you recommend that for neck pain, but that one's $99, the Hypersphere, the mini Hypersphere.
Yeah.
So,
right.
Yeah, because they say they see them, a lot of them at Costco and Target. Maybe they're different brands. I've never seen a Hypervolt at Costco and Target, but I know like Theragun, I've seen that one before. It's a little bit of a different version. But
Theragun is... Yeah, we recommend the Hypervolt for 2 reasons mostly. 1, the Theragun is very large and heavy. And 2, it's super loud.
Yeah.
Like it sounds like a jackhammer. It's really, really loud. They have quieted it down over the years, but it's really loud. The Hypervolt is not quite as loud. And I will say the Hypervolt Go, which is smaller than this, is actually really, really easy to use and easy to move. Should I get it? Do you want me to grab it real quick?
Yeah, go ahead and grab it.
Hey, I'll be right back. Oh, actually,
okay.
Jess is here. She's so kind. She's going to grab it for me. I have it.
Matthew actually let me know. So the Hypervolt, the Bluetooth one is $249.
Oh, it's $249. Okay,
yeah. So it's $249. And that one that's the Go, right?
This is the Go. Yeah. So the Go is much smaller, right? Size comparison for you guys. It's quite a bit smaller. It's quite a bit lighter. Oh, I took the tip off of this one just to switch it on here. It is quite a bit lighter. It's quite a bit smaller. I love this thing. I use it on clients all the time. And if you are someone who's not like super bulky, this is a better fit. It fits in your luggage. Oh, and that's another bonus of the Hypervolt. It is TSA approved. So if you are somebody who travels on a plane, really easy to take it with you. Both of them are.
Yeah.
You can take them in your regular luggage. You don't have to check them. like in a carry-on, right? So this also has 3 speeds to it. The lightest one is surprisingly very strong. It's not as strong as the other one, but it's pretty close. I said the 3 levels on here probably go up to about the 2 levels on there. It's not as powerful, but it is pretty strong. It's very comfortable. It's super easy to lift and carry because it's so small. So this is a big seller for us, actually. A lot of people really love this thing because it's super easy to use.
Yeah, and a big thing with the Hypervolt is if you watch sports, if you watch baseball, anything like that, that you'll actually see them. The Hypervolts in the dugout and things like that. They actually, it's the training system for the NFL and the MLB and the NBA. So they're a great company. They work with everybody. I think they helped Lindsey Vaughn get back.
Yep.
So it's really great. It's a really great product. I mean, it's a good thing to use. I mean, I know I almost cry every time I use it because my shoulders get so tight. But it's like, it's great. It takes all of that, makes it go away, and you don't have to go see a massage therapist. It's one time, you pay one price, and you have it all the time. So we just love them. We use them in the office all day long, right, Michelle?
And I would say that the Hypervolt Go in particular is a big seller because people love it. The people really love it. It's great. It's quiet too, which is nice. So it gives you that power, but it's not that super loud noise. And I will say, I don't know if again, I'm not sure if the Hypervolt, that original product, is what's being sold at Costco and Target, but I think it's important to note that there are a lot of knockoff versions right now, and most of them are fine. They're much less expensive. However, you don't get the quality and the guarantee that you do with Hypervolt. I mean, obviously, as Maya mentioned, a lot of professional sports teams are using them because they last and they work. You might get one for $80 off of Amazon, but it might break in 6 months. So that's something to think about as well when you're making decisions about what product to purchase if you're going to go in that direction. Okay.
Yeah. All right. I'll let you get back to it.
All right, cool. Yeah. So we're just going to keep going. Okay. So, second to last question here that I get asked a lot. Oh, wait. Well, do we have any other questions about Hypervolts or massage tools or anything like that? So I think we can move on from this slide, Maya. Can we? Oh, there we go. Okay. So this is also a super frequent question I get. So I'll be, working with someone for like knee pain, and all of a sudden they'll be like, my neck hurts. I did something. Do I need to see a chiropractor? Maybe, maybe not. Contrary to popular belief, there's no like turf war really between chiropractors and physical therapists. But what I would say is, we are equally well trained, maybe better trained in some regards to treat spine and neck conditions. And I just kind of drew up like a quick comparison here between the two professions on a general scale. We're both doctoral level degrees. Chiropractors have their doctorate of chiropractic, physical therapists have their doctorate in physical therapy. And all of our physical therapists here are doctors of physical therapy. Some of us are actually specialists, like clinical specialists, where we went above and beyond to have specialized training in orthopedics. That's called orthopedic clinical specialty. So, on that level, we're very, very well trained here. Chiropractic professionals, some, again, this is a generalization, will focus largely on manipulations, which is a very passive treatment. We do, as physical therapists, also get trained in manipulations. We use a variety of manual therapy techniques, which is kind of a big term for things like massage, manipulation, and also using some tools. We use something called the Graston technique, which is using like a metal instrument to help. Even things like dry needling fall into that category. And so we use a variety of these things to achieve the same goal. We, however, focus a lot on movement. So if you come in and say, my neck hurts when I do this, our goal is to try to make you not hurt when you do this. We don't want to just use passive treatments to help you get there. We want to make it a global thing, because just doing a manipulation but not fixing all of those other things, like how you're sitting, how you're standing, how you're turning your head, what your exercises look like if you're having pain while you exercise, like those are all things that need to be looked at to actually solve the problem. And so, chiropractors do some exercise prescription. There are some really great chiropractors who, quite frankly, treat just like physical therapists would, right? And there are some who don't. So they can use modalities. We can use modalities. Like I said, there's a lot of overlap between the two professions. And quite frankly, a really good chiropractor and a really good physical therapist are probably going to do a lot of the same things. So my suggestion would be, no matter which direction you choose to go in, you always want to make sure that the provider that you're choosing is getting your goals in mind. If you're going to someone who says that, you're going to have to be treated for, 3 times a week for the next rest of your life because you're always going to be, quote, out of alignment and nothing is ever going to work unless you get manipulated every week. To me, that's not really making you independent. It's not helping you achieve your goals. And I think in this office, that's always our focus is, what are your goals? What do you want to be able to do? You want to be able to turn your heads. You want to be able to work a full day without having to have a headache at the end of the day. Those are the things that we want to try to help you solve and add value to your ability to do those things without pain, without dysfunction. So, we want to, Maya's posting here, like, to help you guys achieve those goals, we have done a lot of different things. Like, I have a rehab Pilates class that helps people transition out of physical therapy into the real world. Dr. J is a golf expert. So a lot of people will finish PT for whatever issue, and then they'll see Jay to help improve their golf game without hurting themselves again, right? Dr. Miriam has AMPS. That's a pediatric condition that I'm not going to get into right now, but it helps kids function better. And Andrew and Lauren have their particular specialties, Andrew being baseball and Lauren specializing in postpartum treatment. So it's all about helping you actually achieve your goals, not just saying, oh, I have this pain, let me provide this treatment. Well, that might help, but it may not solve the whole problem for you because that problem may come back if you don't actually look at the whole picture. So again, having that thorough evaluation is really, really important to actually get to your end game, your goal, right? All right. Any questions before we move on to my last point here? All right. Last question I got. Will lifting heavy things hurt my neck? Doing too much, too fast, too quickly, too heavy is what will hurt your neck. So when you've sustained an injury, an overuse injury, or any of those things, you need some guidance about what you can do. Your neck is actually really resilient. Your whole body is really, really resilient. If it wasn't, we wouldn't have these wonderful ladies down here carrying probably 25 or maybe even more pounds of weight literally on their heads. We wouldn't be able to move furniture. We wouldn't be able to carry our kids on our shoulders. Your neck is actually very, very resilient. And just because you have pain doesn't mean you can't get back to doing things. Doesn't mean that you can't, live your life the way that you want to live it. You just need some guidance about how to do things. And most of us get into trouble after an injury because we feel a little bit better, right? And then we say, oh, I can do whatever I want. I'm just going to go back to doing whatever, because that's what we think. We think, oh, I don't have pain, so I can do whatever I want. And sometimes that works, but sometimes, especially after a more serious injury, you need more time and patience and some very focused training, building on those blocks of stability and mobility again to get you back to where you need to be. And sometimes you need a guide to help you do that, an expert to help you do that so that you know when to push and when not to push. And that's sort of where physical therapy, and particularly in our office, we strive to help people to do that, to help you get back 100% to what you're doing. All right. And let's just move to our next slide. I think this is the last one. Yeah. So as I was saying, the solution really is with neck pain to remember that your body is resilient. You can get better. You need a combination of rest, good nutrition, exercise, patience, and sometimes you really just need a guide to help you along that way. And so if you haven't already, I'd really encourage you to download our neck pain guide. You can click on, I'm sure there's a link you can click, and if not, you can email our office and we'll send it to you. And if you have anything more specific that you want to talk about, by all means, we do provide discovery visits for anyone that needs a little bit more guidance or isn't really sure where you want to go. Maybe physical therapy is right. Maybe it's not. Maybe you need an x-ray. It's really helpful to have a physical therapist to just talk to and say, okay, what is it that I need, right? So if you're ready, the link is right there underneath our video there. Or you can go to www.betterneck.com and check that out for, the neck guide, as well as signing up for a discovery visit. All of our contact information is there as well. We're on Facebook, we're on Instagram, we are on YouTube, I believe, as well. So we've got all of our media covered so that we're really accessible and really easy. And I think we've got it. Do we have the phone number as well available, Maya, so people can jot that down if they want? So she's pulling it up right now so we can see that. All right. So yeah, any other comments, questions, concerns? Again, we want to thank Morris Sussex Sports for sponsoring us and for letting us stream through them as well. It's been really wonderful. I'm glad that everybody was able to join us, and we appreciate that you've tuned in and listened. And hopefully, most importantly, I hope you find this information practical and helpful as you move forward. So are there any questions?
I do have a few questions. More Sussex Sports asked one, actually. They asked, how do I join Rehab Pilates?
Oh, that's a great question. So the classes come around like once a month. I have people sign up for the classes, usually in like a 4 to 6 week block or so, approximately. The rehab classes, if you've never done Pilates before and you haven't been a client here, I usually do a discovery visit with people to make sure that it's the right fit for you.
Okay.
Pilates is a great form of exercise, but if you do it wrong, you can get hurt. And I'm always working with people who are already injured, so I'm trying to make sure they don't get hurt. So most people that join the program have actually been patients first and then kind of come through. You do not have to be a patient first, but you do have to have a screening with me to make sure that it's appropriate. And I have had people where they have got issues where I say, you're not going to be ready for this class. So, maybe you need to be a patient, or maybe you're so good that I'm like, this is too easy for you, and I think you need to try something different. So it's really helpful. So I would suggest, if that's something you're interested in, you want to try one of the rehab Pilates classes, I'd love to have you. I'm always looking for people to join and help that program grow and help more people. But it's best to click on the discovery visit link and set up a discovery visit with me so we can talk about where you are and what you need to do. Okay.
And the discovery visit link, just for anybody looking for it, it is linked in the comments too. It's a lot easier to click. And the discovery visit is, I guess we could explain a little bit more, but the discovery visit is 30 minutes, complimentary, just you and a physical therapist. No obligations. You don't have to become a patient. You don't have to do anything. It just gives you time to talk to somebody and for them to listen. I think that's something, Michelle, we hear all the time, is that people don't feel like they're listened to. So it's really important. We want to make sure that you feel like you feel like you're heard, and it's important to us. Because like Dr. Michelle said, all that we want to do is we want to get you back to your goal. We obviously want to get rid of your pain. We want to make sure that you're doing well, but we want to make sure that you feel good. And whatever it is, whether it's walking down the street for a mile without feeling pain, it doesn't matter. We're going to be there with you, every step of the way, and make sure that you're, well taken care of. I think that's, really important. So we just want to make sure that everybody knows that it's an option. You don't have to do it. It's, there's nothing behind it. Just, it gives you a moment to talk to somebody and for them to listen.
Absolutely. And hopefully direct you as the best path for you. Right?
Yeah.
Whatever that might be.
Yeah, and I saw another question earlier when you were talking about the hypervolts and things. So they said, I keep seeing this spine thing, it's like the spine thing that you lay on for popping your back at home. Do you recommend that? Have you seen that?
Not sure. There's a bunch of those on the market, actually. So I'm not sure which one you're referring to.
I'm not sure which one
is it? There's one that's like I'm guessing it's the one that's a round loop.
It's like a half round. Yeah.
Yeah, and you kind of like lay back over it. They're okay. Yeah. I haven't personally used one, so I can't comment on the exact use of that. But I will say that if it's that general motion, a foam roller usually does the job, and it's usually a lot less expensive.
Okay.
So it's just something to think about. Now, the only downside is if you have tend to have a sensitive back. There are different densities to foam rollers. So we sell 2 different densities, like a really hard one and a softer one. For some people, the softer one is a better fit if you've never done foam rolling before, right? So That's something to consider. But most of the time, you don't need an extra fancy device. Foam rollers do a really, really good job of just opening up the chest as well. It's just a matter of finding the right density and the right size to it, which is something that we can help you with. If you come in for a discovery visit, happy to, discuss that more with any individual that is looking for that.
Yeah, and if you guys sign up at betterneck.com, there's so many great things. We have emails, videos, tons of great stuff. I don't see any other questions at the moment. I would love, if anybody has questions, ask them. That's what we're here for. That's what Dr. Michelle is here for. So I don't know if we want to give them like a minute and see if they want to ask some questions. Just let some music play in the background. Does that sound good?
Sure.
Michelle?
That sounds good. Thanks.
We'll give you guys a moment and see if you have any questions. Any question's a good question. So, all right, we'll be back. Okay, so it looks like we do have a question here, Michelle. More
good.
Sports says, how do the right thing to do for my neck? There's so much information on Google.
Oh, that's a great question. Dr. Google. Oh, Dr. Google. We love and hate Google. So Google obviously has a lot of things, but I think it's helpful to remember that you always want to look at the sources that you're getting your neck information from. You want to make sure that it's being written by a professional, right? A physician or a physical therapist who has really good experience and a good reputation for that information, right? So also, I think it's important to recognize that if you are struggling with a particular issue, information on the web may not be the best place to get your information, only because there's so many things that could be contributing to that neck pain. And Google's not going to give you an answer if the pillow is right for you, right? It's going to show you an advertisement for a pillow that someone paid to have that advertising out there, right? So think about the fact, if you're saying, oh, my neck hurts, like right now, my phone is probably listening to me and I'm going to get a million ads for all kinds of neck products on my phone as soon as this conversation is over, because our phones are always listening. But that doesn't mean that they're giving you the information that you actually need to solve your problem. I think it's really important to have a conversation with a professional, or make sure that you're getting your information from professional sources on the web. Make sure that wherever you're taking this information from, it's not somebody who isn't qualified to give that information. And it can be hard with Google to get there, because the search engines are based off of clicks, but they're also just based off of paid advertising. And so you don't always know. So make sure when you're looking at that Google page, does it say this is an ad? Then maybe that isn't or isn't a good source. I don't know. But you might want to go down and just make sure that whatever links you're clicking on are coming from reputable sources.
Okay. And
hopefully that helps answer that question.
Yeah. One more person asked, what about having an assessment virtually?
Yeah, that's actually a really, really great option. A really great option, because a lot of the assessment is talking, right? Figuring out like what is driving your pain. How did this whole thing happen? So we can do a lot just by having that verbal conversation. And then the second half of that is a movement assessment. See how you're moving, how you're turning, how things are going as far as your ability to function. And that's all stuff we can see visually. So if you're not local to the area, don't let that deter you from signing up for a discovery visit or even an initial evaluation. We've been doing virtual visits since before the pandemic. And we, really embraced it during the pandemic because it's just such a convenient way to get the information out there. And yeah, it's great. It works really, really well. Works really well, especially for the initial evaluation. It works really well.
Good. All right. Well, I don't have any more questions here. I think we've got a lot of information going here. Is there anything that you'd like to say before we go, Dr. Michelle?
No, I just really want to thank everyone who tuned in and enjoyed. And I really hope that this information helps you more than anything, that you can find the value in it, that you can take some of those principles, apply it at home. Hopefully it helps you relieve some of your pain. And, we're always here to help. So if there's something that we didn't address and you want us to address it again, feel free to reach out and let us know, or sign up for a discovery visit and we can have a one-on-one chat.
Yeah, and you can always give us a call too. Me and Marie and Jess, we're all at the front desk. We all here to answer your questions. Anything that you need, you don't have to just right off the bat come into the clinic. We want to make sure that you feel comfortable and that you feel like you're at the right place. So if you have any questions, we're more than happy to answer them on the phone and just be there for you. So we got some comments here. Scotty Bronco, great job.
Thanks, Scott. So glad you
guys
tuned
are
in.
awesome. So we got some good comments here. We love that. Thank you for everybody tuning in. We hope you all have a great evening. Thank you again, More Sex Sports. We always appreciate,
yes.
Love partnering with you. You guys are great. If you've never looked at them before, they do all things high school sports and all of that in the Morris Sussex area. So we hope you guys have a great night. And like I said, everything's in the comments if you need it, all of the links. And yeah, have a good night.
Thank you, everyone. Have a great night.
Bye.
Bye-bye.